So to introduce me, I'm the head of public health here at Flinders University. I'm also co-director of the SURE program with Jackie Bowden. And I'm going to, this session, there's 4 presentations. I'm going to do the first one. We've got one recorded presentation, which hopefully will go well, and 2 other in-person presentations. And as with the previous sessions, we'll hold the questions till the end. So do think of questions, scribble things down as we're going through. I'm going to start off with this rather long-winded title. So it's basically, I want to talk about using survey data to generate evidence to support bold policies which have a limited evidence base. And I think Marina said right at the start, she talked about bold and evidence-based policies. So I'm going to talk about some bold policies using an example from New Zealand, which is where I was previously before coming to Flinders. Okay, and I will acknowledge the EASE, or the New Zealand ITC study team, who have very much been behind this research, and also the funding from the Health Research Council of New Zealand. So this is a tale of soaring aspiration and hope, followed by crushing disappointment, and then left with a sort of maybe undimmed but possibly naive optimism. So first of all, the soaring hope and aspiration. So for those who don't know, in New Zealand in 2022, 2023, there was an action plan launched and legislation which introduced 3 what we call endgame measures. So these are measures with the aim of getting rid of smoking altogether, eliminating smoking, making cigarettes, removing the nicotine or virtually all the nicotine from cigarettes, very much vastly reducing the number of places that sell cigarettes and tobacco, and the smoke-free generation model, which has been proposed in South Australia. I'm going to be talking about the removing the nicotine to make cigarettes very low nicotine cigarettes. That's what VLNC is, if you're wondering what that is. And the idea behind that is that nicotine is the main component of cigarettes that makes them addictive. It's not the only thing, but it's the main thing. And it has effects on people. It makes smoking enjoyable. It makes have a calming effect, possibly just mainly due to the removal of withdrawal symptoms, but nevertheless, that's how it's interpreted. And it makes people feel that they're addicted. One of the problems with all of these measures, in fact, is they've not been done before, or not been done before at a national level. So New Zealand was going to be the first to do all these 3 things, which is the soaring hope and aspiration bit. So there's no, and because they've not been done before, there's no actual evidence from their implementation, no real world evidence. There is evidence from sort of simulation type research, including randomized controlled trials. And I think still the biggest one that's been done was done in New Zealand and was led by Natalie. So there is evidence, and essentially what you do is you give people very low nicotine cigarettes and ask them just to smoke those cigarettes. And then you see what happens, whether they reduce their smoking or quit, or what happens. So we didn't have, so that's good evidence, but it's not perfect. It's not like implementing a full policy. It's not real world evidence in that sense. So we didn't have that evidence, but that was about to change. And what's more, we were ready to provide that evidence based on the fact that this was going to be implemented. And we were ready because we had this thing called or one of the reasons we were ready was we had this ITC study, or the New Zealand arm of it. And the ITC study, to simplify it, you can think of it as repeated cross-sectional surveys. It's actually a bit more complicated than that, but let's call it repeated cross-sectional surveys done every 12 to 18 months. And they involve people who smoke or have recently stopped smoking. And what that means is you can measure things before and after policy implementation to see if they change. Like, do people quit more? Are people more motivated to quit? And one of the things that the ITC does is it builds in what we call policy-specific or policy-proximate measures. And so what that might look like is if we were introducing, say, graphic health warnings on cigarette packs for the first time, we might gather evidence on whether people notice the warnings that are on packs, whether they take any notice of them, whether it makes them think about quitting. And then we measure that before, and then after the graphic warnings, the pictorial warnings with the nasty pictures on are introduced, do those things change, i.e. do they increase? And if they do, that it looks like the policy is having an impact. And if that is associated with increased intention to quit and quit attempts and successful quitting, that gives you some evidence that that increase in quitting may be attributed to that policy change. So that's how the ITC study works. And that's what we had in New Zealand. And so we were all ready to evaluate. We had these waves of, the New Zealand ITC is called EASE for various reasons, but we had, the policy was due for implementation here, and we had these two waves of data collection, so we could do exactly that sort of research. Marvelous. But the policy wasn't implemented, and hence the crushing disappointment. So we were thwarted in trying to evaluate the policy. We still had the, oops, sorry, that's a bit trigger happy. We still had the data, and I'm going to be talking about the wave 5 data here. But we didn't have the before after. The government, the new government, the policy was repealed because a new government came in and did all sorts of, in my view, unfortunate things, of which this was one of them. And they did introduce another plan, and that had absolutely no tobacco control policy measures in it to replace the ones that they'd got rid of. But they did talk about enhanced smoke-free campaigns, mass media campaigns, and also enhancing the delivery of smoking cessation services. And if you look at the sort of rhetoric, the media releases and some of the forwards and things for this policy, they talk about getting people to have another go at quitting. What they need is the tools to help them to quit. And it's almost like sort of personalizing and individualizing and saying it's up to the people who smoke to try harder. And we'll give you the support, and then you'll be able to quit. So that was sort of the new plan. So we had this study, and we'd included, because we were getting ready to evaluate the new measures, we'd included a whole load of questions about whether people felt they were addicted, whether they thought cigarettes were addictive, whether they found smoking cigarettes enjoyable, calming, relieving stress, and all these things, because we thought these might change after the policy came in. So, but we had that as sort of baseline data. And so what I'm going to be presenting is how we can maybe use that data to still provide some evidence, not the evidence that we wanted, but still some evidence. So this is the New Zealand study, about 1,370 participants, almost 1,000 of whom were people who smoked. So we collected all this data, and we included lots of policy-specific measures. The government said that people need to keep trying quitting, sorry. Well, yes, Freudian slip. And they are. 83% have tried to stop smoking at some stage. 35% have tried in the last 12 months. And obviously these people have not succeeded because they're still smoking. And about 2/3 said they intended to quit. So they are trying. That's not a problem. They want to quit. The trouble is, they didn't think it was going to be easy to quit. In fact, of daily smokers, less than 1 in 10 thought it would be easy to stop smoking. So that sort of begs the question, well, why did they think it would be hard to stop smoking? Was it because they couldn't access smoking cessation support services, for example? Or was it because they found that tobacco was very addictive? So we asked questions like this, and one of the sets of questions we asked this in a variety of ways, was how do people view the cigarettes or tobacco that they most frequently smoke? Do they think it's addictive, satisfying to smoke, and calming? And yes, they do. 80% plus think it's all of those things. Do they think it's easy to quit? As I said, no, they don't. Okay, so that's one way of asking about it. Another way we asked was, what do they think facilitates them continuing to smoke? What are the things that they like about smoking? What's enjoyable about it? And the same sort of things. They think it's addictive. They think nicotine's the main substance that makes it addictive. And they find it calming, the effect of smoking. The other possible things which are not plausibly related to nicotine, like the smell or taste of the tobacco, were not prominent things. Some people liked those, but that wasn't the main things. Were, let's say, the addictiveness and that it's calming and relieves stress and so on. So it's more evidence along the same lines. We then asked another way. We asked about barriers. What are the things that are stopping you from smoking? And we asked the same sorts of things. And what they said was, well, addiction, especially the people who smoke daily, it's because I'm addicted. It's because the cigarettes are very satisfying, and satisfying is a way of expressing the effect of the nicotine. And it helps cope with stress, which may be, again, taking the withdrawal symptoms away. So those were the things that people said were barriers to stopping smoking. But we also asked about some other things, and the very low bars there were access to smoking cessation support. Only about a quarter said that was a barrier, whereas 80 to 90% said addiction was a barrier. Only about a quarter said not easily being able to access smoking cessation support was a barrier. And then we asked a separate question, which isn't on the graph. So only 12% of participants thought it would be somewhat or very hard for smokers to get help with stopping smoking. So the government was saying we need to give smokers, people who smoke, more support, but people who smoke were saying, well, that's not a major barrier. But what is a major barrier is addiction and the satisfying and enjoyable nature of smoking, which is a lot of that is to do with the nicotine. And then we asked another question was, what things were making you think about stopping smoking? As another way of looking at this. And the commonest things by far were the cost of smoking and the health effects, which is what you find in just about every survey that you do this. Cost of cigarettes in New Zealand, they're not quite as expensive as in Australia, but they're right up there. They're very expensive. And health effects that's always there in all of these surveys. But about half, approximately, people also said other factors like getting advice from a health professional to stop, or being prompted by mass media. So that was having some effect. But interestingly, if you look at this column here, shows that the effect of the announcement of the 3 endgame laws had approximately the same effect as a trigger to prompt quitting as health professional advice and mass media. This was just the announcement. These things had not been implemented. They'd just been announced with the intention to implement them. That was as big a trigger as receiving advice from your doctor or seeing a mass media campaign encouraging people and supporting people to quit. And finally, you might say, well, we could ask people what they thought the impact of the policy would be, and that's what is shown on here. I'll just show one here. This was what would you be likely, or how likely I think would you be to quit if the denicotinization that was brought in, and about 50% of daily smokers, 75% of people who smoke less than daily, said they were maybe or likely to quit. It was much less for likely, which is the next set of columns, but a substantial proportion. Of course, there's some uncertainty about this because this is what people anticipate. You don't quite know how that's going to play out. So what does this all mean? So I think there's several lines of evidence from this that bringing in a mandated denicotinization of cigarettes, which was what the proposal was, is likely to have a major impact in prompting and sustaining smoking cessation. And we can say that because people who smoke are saying that themselves. That the big problem, the big barrier they face is being addicted and smoking being highly enjoyable for many people. And it wasn't the things that the government was going to target, in particular, giving more cessation support, which is a good thing, but it wasn't the main problem. And I was trying to think of a visual analogy, which would have been more helpful if I'd actually drawn it out. But I was thinking you could think of this as if you're trying to quit smoking, and it is hard. Obviously, people do quit, but it is a challenge for a lot of people. It's like there's a big wall in front of you, which is topped by barbed wire. And if you think of the barbed wire as the nicotine, what the government's proposing was to give people a stepladder, which would help them to get near to the top of the wall, but they then still got to get over the barbed wire because the nicotine's there, the addiction there. So if you remove that barbed wire and give them the stepladder, then they're probably going to be able to hop over the wall. But the sort of methodological thing is that the policy-specific survey variables, which were put in there to evaluate as a before-after study, can also be useful for generating some evidence that these measures are likely to be successful, because they provide that sort of contextual information about why people find it difficult to quit, what the barriers are, and what's prompting them to think about quitting. So they're useful, obviously, for valuation, but they're also, I think, useful in that way as well. So what I would argue is that we should be putting these policy-specific measures, thinking about them, putting them into our population surveys, because they may be very, very helpful if either the policies are introduced, but even if they're not, they may help generate the case, build the case for introducing the policies. So that's a lot. And so that's the naive optimism at the end. And by doing so, we might actually get these policies introduced. Okay, thank you. So we can move on to the next slides now.